Chido. Chido is a Say What representative. Good morning, Chido.
Morning, my Judah. How are you?
Let's try this again. Good morning, Chido. Hello.
Hi, my Judah. How are you?
I'm good, thank you. All right, welcome back to teenzim.com.
Thank you so much for having me again.
All right, and also joining us today is Tanatswa Chikaura. She is a mental health advocate. Good morning, Tanatswa. Welcome to The Breeze.
Morning, my Judah. Thank you for having me.
Lovely. So today we are looking at COVID-19 and its effects on mental health. And the question is, will it ever end? Before we get into it, maybe Chido, you can tell us who Say What is all about. Talk to us about the organization and what you focus on.
Thank you so much, my Judah, for having me again. Hello, everyone. My name is Chido Deborah Mawire. I am a programs intern at SAYWHAT organization. Now, SAYWHAT on its own is an abbreviation that stands for Students and Youth Working on Reproductive Health Action Team. Now, it's in the name itself. We work on the sexual and reproductive health of young people and students in tertiary institutions. So we're all about helping young people make informed, wise decisions that are pertaining their sexual and reproductive health. We are all about advocacy. We're all about information dissemination, just anything that helps us to reach out to the young people and help them in making informed decisions when it comes to their sexual and reproductive health, and making sure that they're aware of their sexual and reproductive health rights and so on and so forth. So yeah, that's our main focus area.
Okay, thank you so much, Chido, for coming through there. And moving on to Tanatswa, our mental health advocate. What is mental health?
Okay, so mental health is our emotional, psychological, and social well-being. It refers to how you think, how you feel, how you act. So when we say mental health, usually people will say, we are not rwara nepfungwa. But it's not kurwara nepfungwa. Utano wepfungwa wako. Urise iwewe semunhu. How do you interact with other people? How do you manage stress? That's mental health. It's every stage of our life, from childhood to adolescence through adulthood.
Okay. And iyo nyaya yacho na iyo yokuthi, will it ever end? That's the question.
Well,
is this the
health,
question that you are getting from the youth?
Well, from the youth is not will it ever end, but how is our mental health being affected? So mental health cannot necessarily end because that's you as an individual.
Right.
Like that, how are you? But then will COVID-19 ever end is the question. And thinking about those answers affects our mental health as young people. Because we don't know what to do, how to react, what do we say? What's the future like?
That is so
very
true.
Difficult.
You're going to say it's very difficult?
Yes, I was saying so it's very difficult to even think about that, to think about the future, especially with the third wave coming along and taking so many lives. We don't know what's going to happen. Now, at first when COVID started, it was, will I graduate? Will I write my Form 4? Will I write my upper 6? Will I continue with school? And then now it's, okay, will I live? Will I see the next day? And imagine as a young person thinking about that.
Okay, so after the young people have thought about that, what are the steps to take?
So the steps to take, for young people are very difficult to understand. You never know what young people want. And with social media, it's easy for young people to be entertained, to forget about things, to not think too much about life, to focus on other things. So even when we're talking about mental health, some young people don't know what their mental health is. They don't understand what depression means. They don't understand what anxiety means. So even trying to tell people about the services that are available for them to get help is difficult before telling them what they are going through. So with young people, you need to know what is the information they have.
Okay. So who starts this conversation?
The people that start this conversation is us. Us having this conversation right now is a starting point, because people are able to then understand, okay, if mental health refers to my psychological well-being, my emotional well-being, how am I feeling right now? I'm doing online learning. I'm at home. I'm a young girl. I'm a young lady. And I'm supposed to balance my academics as well as my house chores. But then that's getting so overwhelming. How best do I balance it? Can I communicate with my parents that this is what's going on? I need to first finish school, then do the cleaning. I'm doing the cleaning today and focusing on school tomorrow. How best do I find that balance? Those are the small things that can overwhelm young people.
True.
And then you've got situations where you've got young people that genuinely want to talk to people that are not feeling okay, and they need places to go to. And we've got organizations like Friendship Bench. They have online peer counseling that's available. You talk to someone. So and then if it's severe and they really want professional help, you've got the Zimbabwe Psychological Association. They have a representative there you can talk to, and that representative can direct you to psychologists.
All right.
We also have a mental health online platform with counselors in Zimbabwe. So there are options that are there for young people.
All right. Thank you so much, Tanatswa, for coming through there. What can young people do during such times, especially during this pandemic, to maintain a positive mental health?
That's a very great question, my Judah. Thank you so much for asking that. Young people need to be there for each other. They need to support each other and not bring each other down. It's very unfortunate that since the pandemic started, drug abuse has increased in our country. This year we lost two male students, university students at NAS, to suicide. And these are some of the issues that we don't talk about, things that we don't know is going on, or things that we avoid. People avoid uncomfortable conversations. As young people, let's support each other. Let's not bring each other down. I really love that SAYWHAT is having the sassy debates currently. You can watch that. Watch your fellow peers participating in that, and also support them. Even as a young person, also participate in that. And also, since the pandemic started, you're seeing young people doing things that they never thought they would do. Some people are now singing. Some people are now bloggers. People are now content creators. People are finding things that they never thought they could find within themselves. And always maintain a positive mindset. Positive affirmations all the way. You don't know what tomorrow holds, but you just speak positivity into your life. I'm going to graduate. I'm going to finish school. I'm going to write my Form 4. I don't know how, I don't know when, but I'm going to do it. And whilst I wait, I'm going to focus on what's there. If it's your academics, focus on it. If it's you doing other work, focus on that, but maintain positivity in your life.
Okay, thank you. It is 10 minutes before midday, and now we cross over to Chido to find out from you, Chido, what role SAYWHAT is playing, or should they be playing, to ensure the mental well-being of young people is solid, is stable.
All right, thank you so much, my Judah, for the question. Organizations like SAYWHAT and other partnering organizations can play a part by firstly advocating for mental health. It's one thing to preach, mental health, but it's another thing to actually advocate for it with the right information, reaching out to as many young people as we can, using all the resources that we have on the ground. And as much as we can't do physical advocacy campaigns and whatnot, let's make use of social media. Let's make use of whatever it is that we have at our disposal, radio, TV. Utilize all of it and just reach out to all the young people out there and assure them that, in as much as this is a dark phase that we're going through, there's light at the end of the tunnel. There's hope. It's not the end of the world. We are going to make it, but we have to make sure that we take care of our mental health, take care of each other. We reach out even to the communities and make sure that they have conversations with young people, with their children, and just ask them, are you okay? How are you going through this and that? How is school? You are doing online learning like Sananso mentioned. How is that going? Have conversations with young people. Ask them about their social lives. Just make sure that you keep them engaged so that they know that there's someone there to listen when they have problems. So it's our duty to reach out to everyone out there, because it's not just the job. SAYWHAT cannot as a mental health advocate. It's everyone's job. Even in SAYWHAT, we talk to each other and we just engage each other so that we make sure we're at the same plate, we're on the same level, and we communicate, we talk about this mental health issue.
Okay, thank you. How can people get in touch with you, Tanatswa, and also how can people get in touch with you, Chido?
Okay, so if you want to get in touch with me, you can follow me on my social media platforms and also message me there. On Twitter, it's Tana_Chikaura. On Facebook, it is Tanatswa Chikaura. And on Instagram, it's Tana_Chikaura.
Okay, thank you. And how can we get in touch with Say What?
All right. For more information pertaining mental health or any other issue that affects you as a young person, you can get in touch with us via our call center, and the number to dial is 577. I will repeat, 577. And we are also available on all social media platforms, that is Facebook, Instagram, Twitter, YouTube. You just search Say What Organization and we are there for you.
Okay, thank you so much, ladies. You take care.
All right,
Thank you so much, my dear.